Good morning, everyone. It is a beautiful, beautiful day in eastern Pennsylvania. That's right, I am officially in eastern Pennsylvania. Still settling in, still sort of learning my way around. This is a large lake in eastern Pennsylvania that I've already paddled on once, and I just found an even better put-in, which I'm super excited about. Lots of people paddling here, lots of people sailing here. It looks like a really wonderful place. Today, I want to talk about myths and misconceptions about wilderness medicine. Let's go. Hello everyone, good to see you again. Good to be somewhat settled in our new state, our new home. Still lots of settling in to do, lots of research about put-ins and things like that. I have already gone on a really nice day hike. So far, it's been 2 weeks. I'm really enjoying eastern Pennsylvania. That is not what I want to talk about today. Today I want to talk about wilderness medicine myths and misconceptions. So last year, I taught 18 wilderness medicine courses with an average of 20 to 25 students per course. That's like 400 and change students, depending on how you do the math. And I've been doing that for over a decade. And so that is a lot of students bringing a lot of myths to me about things that they've learned about wilderness medicine specifically, medicine in general, but wilderness medicine specifically. So I want to hit some of those today. I thought it would be a fun thing to talk about while I am enjoying this view out the side of the van. You cannot beat this view out the side of the van. But that's not what we're here to talk about. We're here to talk about backcountry wilderness medicine myths and misconceptions. Okay, here is the one I probably see the most, and it's purported in videos a lot, and you see it sort of associated with the expensive first aid kits that people sell, and it drives me crazy because it's insane, which is people learning how to do sutures for use in the backcountry. You do not want to use sutures in the backcountry. So the first thing is, let's talk about how they're doing sutures in the front country. You go to an emergency room or a clinic or an urgent care with a wound that needs to be stitched. They are going to clean the area with a sterile solution. They are going to give you an injection so you don't feel the process of getting stitches. They are going to irrigate the wound for a prolonged amount of time with that sterile solution. And that sterile solution may also be an antibiotic wash. And they're going to start you on a course of preventative antibiotics. None of those are things that we can do in the backcountry. Backcountry wounds tend to be dirtier, and if you stitch them or glue them or anything like that, and they show signs and symptoms of an infection, we can't reopen them in the backcountry. Besides the fact, without the ability to give you something like lidocaine, which is what they generally give as a local anesthetic when they're doing sutures, it's going to hurt, and I'm creating more wounds with that needle. You do not need to learn how to suture something in the backcountry. Remember that sutures are just closing a wound. They're not stopping bleeding. It's just to close a wound. If you've got a wound that is so big in the backcountry that you can't close it, you should evacuate that person and get them into the front country. Number two, don't put anything in wounds besides potable water. So you can irrigate a wound in the backcountry with any water that is suitable to drink. If you can drink it, you can use it to irrigate. And when I talk about irrigating a wound, I'm generally talking about using an irrigation syringe, which creates really great pressure. Irrigation syringes cost $1 or less and weigh an ounce or less. If you use a Sawyer water filter, you can use the cleaning syringe as your irrigation syringe. So that is a normal piece of first aid kit gear that I talk about a lot. But you can just irrigate with anything. We don't want to put neosporin, bacitracin, alcohol, antibiotic ointment. We don't want to put anything in the wound because all those things are going to slow the rate of healing. You can put an antibiotic ointment on gauze, which is going to go over the wound, but even that you don't have to do. So let's not put anything in the wound except the water we're using to irrigate. Okay, next, you probably don't need a tourniquet in your first aid kit. Recently on a course, I had someone say, if you can carry one, you can carry two. Clearly this person was not an ultralight backpacker. But the only people that I say that you might need a tourniquet for, and when I'm talking about a tourniquet, I'm talking about a commercial tourniquet device like the CAT tourniquets that we demo on Knowles courses, which do actually work really well. But I don't think you need one unless you work with chainsaws, axes, machetes, or guns. Those are the only things where I think that you would need a tourniquet. And I'll be honest, when I worked in the ambulance, I saw gunshot wounds. I never needed the tourniquet. So I don't think you need one. That said, if it gives you peace of mind to pack one, they're 30 or 40 bucks. They don't weigh all that much. They don't take up that much space. But I'd be willing to bet you never use it. I'd also be willing to bet if you do use it, you didn't really need to use it. It was just easy to use and you were worried, so you used it. Chances are you didn't need to use it. Okay, next. You can improvise a lot of things, but you can't improvise gloves. These are my gloves of choice. This is the Halyard Sterling Nitrile, a really great glove. I used to hear Knowles wilderness medicine instructors say, oh, just put plastic bags over your hands and use that. If someone came at me with plastic bags on their hands, I would think they were crazy and I wouldn't let them treat me. Again, a box of gloves like this costs about 15 bucks. This is over 100 gloves, or this is 200 gloves, so 100 pairs. Again, weigh nothing, cost pennies, totally worth it. I throw them everywhere. They're in my first aid kits. They're in my van. Gloves. Okay, this one is going to piss people off. Don't use duct tape on human skin. Duct tape is not designed to be used on humans. The glues have all sorts of things that aren't great on your skin, can cause localized reactions, and you certainly don't want it over an open wound. You can use regular bandage stuff, but you can also use like KT tape or rock tape, which works better than duct tape and is designed to be used on the human body. Next, frigid water won't kill you in minutes. Hypothermia will not kill you in minutes. It takes a while for the signs and symptoms of hypothermia to really affect you. As someone who has paddled in Alaska and has demoed self-rescues and wet exits in Alaska in 40 and 50 degree water, I can tell you, yeah, it's bloody cold, but I operated for 20 minutes, 30 minutes in that water. And I've even done that without a dry suit, just in a pair of shorts and a t-shirt. So you can absolutely spend a fair amount of time in cold water without it killing you. It does not kill you in minutes. And as I was researching this, I did a Google search for how long can you survive in cold water. And the very first hit says it will kill you in minutes. Absolute nonsense, does not happen. If you want more information on this, check out Dr. Gordon Giesbrecht or just Google Dr. Popsicle. He's done a ton of research on this and has come up with the 1-10-1 rule. You have 1 minute after immersion in frigid water to get your breathing under control.
Cold skin starts a cold shock response, which gets you first start gasping and hyperventilating and breathing way more than you need to.
The main thing you need to think about for the first minute is just not drowning. You don't have to get out. You don't have to do anything else. Just get over that. Just try and get your breathing under control. And when that happens, then you've got some time to try and do other things like get out.
You have 10 minutes of usable muscle control. You have 1 hour before you become unconscious. I haven't been in water that long. Maybe I'd have been unconscious in an hour, but I seemed pretty good after 20 minutes. Maybe it just seemed like 20 minutes. Okay, so you will not die within minutes of falling in frigid water. Okay, this is one of my favorites. Follow this progression. If you have a tick on you, you do not have Lyme disease. If you find a tick on you that has bitten you, you do not have Lyme disease. If you find a tick on you that is engorged, you probably don't have Lyme disease. Here is what needs to happen for you to get Lyme disease from a tick bite. The tick needs to bite you, engorge itself, and then release from you. Because what happens is when they release, they regurgitate a little bit of your blood back into you, which is now infected with Lyme from the tick, and it's back in your system. That's how you get Lyme disease. Most people that get Lyme disease never know a tick was on them. The other thing to consider is most ticks don't have Lyme disease. There are other tick-borne illnesses. Ehrlichiosis is one. Tick-borne encephalitis is another. So ticks you should take very seriously. And if you're in an area with a high tick population, you want to be checking yourself out. You want to be taking precautions, things like that. But just because you see a tick on you does not mean you have Lyme disease. Okay, another good one. I used to see this a lot when I worked at REI. Someone would come into the store on Friday, buy a water filter for a trip they were doing that weekend. They would come back on Monday and return it because they used the water filter on Saturday, and on Sunday they had diarrhea, which they were positive was Giardia. So clearly the water filter does not work. Wrong. Giardia and Cryptosporidium, which are the two most common things in water that make us sick, that we need to filter out, have a much longer incubation period in your system than you would think. Giardia is 7 to 14 days. Cryptosporidium, or crypto is what most of us call it, can be as little as 48 hours, but is more likely a week to 10 days. It takes time for them to get into your system and start reproducing in your system. And after millions of them have reproduced into your system, that's when they start interfering with digestion, and that's when you start getting things like diarrhea and vomiting and dehydration. So what happened to that person who brought their water filter back on Monday after having diarrhea on Sunday, having used the filter on Saturday? If it wasn't Giardia, what was it? Chances are they didn't wash their hands well after going to the bathroom and infected themselves with their own feces. Yeah, wash your hands after you go to the bathroom in the backcountry. Okay, this is another one of my favorites, and we see this in videos all the time. Here is one from Dan Becker.
Having severe chest pains all night long.
I didn't know what the chest pains were. I thought it was maybe altitude sickness. Everybody else thought it was altitude sickness.
Here is one from Kara and Nate.
Okay, so I think the medicine got rid of my fever, at least momentarily. My head still feels like it's gonna explode, but we're gonna hit the road. There's a town called San Miguel that should be about 30 minutes away. And if nothing else, if this is altitude sickness, that town is 2,000 feet lower than this one, so that should help a little bit.
It probably isn't altitude illness. Both of those videos, they did not have any of the signs and symptoms of altitude illness, but were blaming recent altitude gain. So acute mountain sickness is defined as recent altitude gain and a headache. If you have those two things, you have acute mountain sickness. I get it every time I fly to Denver. It lasts for an hour and a half and then my body acclimates. Both of the people in those two videos had completely different signs and symptoms. They had runny noses, they had fever. Dan had chest pain. None of that stuff are signs and symptoms of altitude. You've got two other options for altitude illnesses. High altitude pulmonary edema, which you'll be coughing and will cough up a pink sputum, that's fluid in your lungs. High altitude cerebral edema, that's fluid in your brain. You'll have severe headaches, can't focus, can't stay awake, change in levels of responsiveness, all of those things that we see essentially from head injuries, but you'll get it solely from altitude. The treatment for both of those? Descend, get your altitude down, seek medical treatment. But the treatment for acute mountain sickness, light exercise, hydration, yeah, take a day off maybe, and then keep ascending. Okay, that is a whole bunch of backcountry wilderness medicine myths and misconceptions. I hope that straightens things out for you. If you've got more you want to ask about, you can put them down below. You can support me by buying me a coffee on Ko-fi. My books are available on Amazon. I think that's about it. I'll see you on the water.